introduce yourself. You're gonna let Mr. Smith know that we're gonna be cleaning your dentures today, okay? It's right after breakfast, so we need to clean your dentures, all right? So you're gonna need a towel. I'm gonna get my little table. Go ahead and get me some gloves, because I'm gonna need gloves, because you don't wanna do what? Take these teeth without gloves, right? This is your infection control part of it. Alright. So I'm going to wash my hands, close my curtains. I'm going to take his call light. Now this one doesn't, it just says position the patient what?
Sideline position.
No, this is no, that's unconscious. This is dentures.
Denture is.
It doesn't really say. So I'm going to raise him up in a semi-Fowler's position. Alright, because I'm going to brush his teeth, right? So now I'm going to put the towel across his chest. I've got my emesis basin. I'm going to make sure I put it underneath there to catch his teeth, okay? There it is, there. Now I'm going to put my gloves on. And I'm going to ask Mr. Smith if he can remove his teeth, right? And if he can't, I'm going to have to do what? Assist him with his teeth. So I'm going to get my cup out. Alright, so I'm going to take my 4x4 and I'm going to open this up and I'm going to rock backwards and forth on that upper denture until I break the seal and I can get it out. Then I'm going to put it in my emesis basin, okay? So I'm going to take my finger, my pointer finger and my thumb, I'm going to pull down on his bottom lip. I'm going to take my 4x4 and I'm going to rock backwards and forth on the bottom teeth until I break the seal, until I pull them out, okay? And I'm going to put them in my emesis basin. So I'm going to put my 4x4 there. I've got my teeth. I've got my dentures. Now I'm going to take my teeth, my dentures, and my denture cup, and my emesis basin, and my toothpaste all to the sink. So everybody's going to have to follow me to the sink. Alright. These teeth, if you are not careful, they'll break in the sink. So you're going to line your sink. You're going to turn your water on cool, because we don't want hot. We're going to have cool water, and we're going to line our sink with paper towels. Alright? If you want to, you can use a washcloth. It's fine. But we're just going to use paper towels. Okay, we're good. So I'm going to set my cup down. I'll drop my toothbrush. And I'm going to take my emesis basin and I'm going to rinse my teeth. Alrighty? I'm going to set this down and I'm going to rinse my emesis basin out because it's dirty. I'm going to turn this water down so it don't get much water in there. I'm going to take my toothbrush. I'm going to put toothpaste on this part of the brush. If I can get this toothpaste out, it's like cement. And then I'm going to put some on my other end, right here, this little pointy end. Okay. All right. I'm going to take my top teeth, and I'm going to start brushing in a circular motion. I'm going to take my pointy side and I'm going to get all that denture cream out in those crevices in his mouth. Alrighty? I'm going to rinse my teeth. I'm going to open up my blue container. I'm going to put those in there. Now, I'm going to take some more toothpaste and I'm going to rinse and brush his bottom teeth in a circular motion. I'm gonna take that pointy side and get all that denture cream out of that crevice in his lower lip, on his lower teeth. Then I'm gonna rinse. Now I'm going to rinse my toothbrush. I'll put his lower teeth in the cup. Since my emesis basin is clean, I'm gonna put my clean toothbrush in there. I'm gonna get rid of my paper towel. Now, if I were gonna store these teeth, what am I gonna put them in? Cool water or hot?
Cool water.
Cool water, and where do I store them at? Top drawer or bottom drawer?
Top drawer.
Top drawer. But since it's right after lunch, what am I gonna do?
Put 'em in.
I'm gonna take them back to the bedside. Alright. Take them back to the bedside. Now, his teeth are clean, but is his mouth clean?
No.
Right. So I'm gonna take my clean emesis basin, and I can do one of two things. I can ask him to rinse his mouth out, or I can clean it. So I'm gonna put a little bit of mouthwash.
We will pull the glue off if they have like glue stuck to their gums. Like,
Yeah, you'll get that denture stuff off. I'm gonna put some cool water in there. Now, if he can't rinse his mouth, I'm gonna take, he tells me, no, I can't rinse my mouth. I'm gonna take this little toothette. Get it open.
we did the other end. We usually have push out those.
Yeah, there it
There
goes.
it goes.
I'm gonna take this toothette, and I'm gonna go around and around in this water here, getting out the excess. I'm gonna hold this emesis basin. I'm gonna ask him to open the mouth, and then I'm gonna clean the chewing surfaces of his gums on both sides, at the top, his cheeks, and his tongue. Alrighty? And I'm gonna clean those chewing surfaces. If he has teeth left in there, and it's just a partial plate that I clean, then I would brush his teeth with toothpaste. Alrighty? And you can put it on this toothette and brush it with the toothpaste. Alright? And let him spit it in the emesis basin. So I've got him to do that. I've cleaned his mouth. I've cleaned the chewing surfaces of his mouth. Now, can you put your teeth back in, Mr. Smith? You can't? Okay, so now he wants his teeth put back in. I've got my 4x4 again. I'm gonna grab my upper plate with my forefinger and my thumb. I'm gonna raise up his upper lip, and I'm gonna insert his upper teeth, alrighty? Then I'm gonna take my 4x4, take my bottom teeth, hold it again, forefinger and thumb, open up his mouth, and insert his bottom teeth, alrighty? Now, I've got his teeth done. I'm gonna take away, make sure that his mouth is nice and dry. I'm gonna take my towel away. I'm gonna remove my gloves, because now my gloves are dirty. I'm gonna get rid of my gloves. I'm gonna clean up my supplies. I'm gonna empty out my water. Empty out the water and stick it back in the sink. I'm gonna make a mess. Okay, empty out your water. That's all. Am I gonna leave him sitting up? No, I'm gonna put him back down.